Okay. Can everybody see my screen right now?
Yes, we can.
Great. Well, I appreciate everybody's time. My name is Mark Wien. I'm the founder and CEO of PocketPatientMD. I'm just going to show you our platform. I'm not a technical person, but our platform is interoperable per GDPR and HIPAA guidelines, and it's designed to really work within the framework of HL7 and OpenHIE and what OpenHIE aims to achieve, but with our focus on really getting the doctors to use it, because a lot of times there's a lot of technical people in the room, and it's very, very hard to get facilities to transition, especially from paper to digital. So what Pocket Patient MD is it's a digital health and electronic medical record platform. It's interoperable, so that means that it can link to any existing system or platform. It can link to any application, any lab or diagnostic center, or any pharmacy. It's customizable. We know that every Ministry of Health, every hospital system, even every doctor's office can be slightly different. So as a result, it's completely customizable as long as the changes meet local rules and regulations and meet best practice standards. So we can make changes as minor as adding additional survey questions if the doctor wants to include that, to essentially white labeling the system for larger partners, as well as adding features. It's online and offline, so we want to make sure that this is a platform that can be used even in areas that have poor connectivity or high data costs. What we're seeing is, even if there is connection, the cost of data can be very, very high, and it's important that these tools are all affordable and accessible. So that's why we have online and offline capabilities. It's in multiple languages. So our platform right now is in English, French, Spanish, Arabic, Portuguese, Swahili, and Vietnamese. And we're beta in several other languages, including Amharic, Malagasy, Indonesian, Hindi, Russian, and others. So you can see even the homepage, you can just choose the language that you want, and it will shift from language to language very, very simply. And again, we even have it in Swahili and Amharic. And the platform is designed where a doctor can just pick it up and start using it. On the back end, the technical part is complicated, but the most important thing is that the physicians and the frontline health workers are actually using the platform. So Pocket Patient MD is completely free. That includes training and support. It's permission-based, so you can create accounts for other health practitioners, community health workers. And when you sign in, it just asks you where you are. Are you in your doctor's office, or are you in your hospital? You immediately can go to a dashboard, see appointments, and see basic statistics. So you can actually run queries and run reports of your choice. So, and we can even work closely with ministries of health and larger hospital systems to produce the monthly reports that are often required to be sent in. We've also been talking to a lot of sickle cell centers, again, where standardized reports are needed, and a lot of time is lost trying to put these reports together. When you go to your list of patients, you can either add a new one or click an existing one, and you'll see how the patient record's very, very easy to read. You can see allergies, medications, and conditions. Serious markers have this. For security, anyone that's immunocompromised, HIV, tuberculosis, cancer, you just have to re-enter your password to see what condition that person actually has. Again, you can upload labs and diagnostics. This is very important too, because in a lot of places, there is a technology and there are the tools, but there aren't the professionals. So for example, you might have a clinic in a rural area where they have X-ray machines or MRI machines, but they do not have a radiologist to read them. So now you can even upload tests and screenings and have a doctor or a specialist in a capital city or even abroad provide a good read, which is very, very important in care. Vaccinations, again, administration date, next due date, and you can even print all of this, which includes vaccination cards. Vitals, you can track over time, and we keep track of things like BMI automatically, and then the medical note, which again is very, very simple. So we really want to just enable the doctor to be able to input the information there as quickly and as comfortably as possible, so that way it can have the maximum impact on the patients and on the population. And you can even schedule a follow-up appointment. So with this, we can even work with systems to ensure that patient compliance increases by getting follow-ups for appointments or when someone needs their medication. Again, we have an administration panel, so doctors can be parts of different groups: OB/GYN, cardiology, pharmacy. You can invite doctors to join, and you can create staff accounts. And this is completely customizable and permission-based. Again, every facility is different, so you can pick and choose what employees at your facility can see and do what. Who can view, create, and edit new patients versus actually viewing and editing the health record. Maybe a pharmacist, for example, can only view allergies and medications and vaccinations and can't edit anything. So you have a lot of control there. And then again, the platform is in several languages. So, if you have a patient like this guy, Saul Batista, let's say that he goes from, let's say he goes to, let's say he goes even to a French-speaking country, it will very, very quickly just convert his language, his record into that language. To make sure that the doctors can always access accurate, accountable health information to maximize the impact. So, with this, really what we're doing is we're using and continuing to try to build in the tools that OpenHIE is striving for, but in a manner where we can actually get the doctors and the health systems to embrace it and start to use it. Because one of the biggest problems we have seen is actually getting the training done and getting a doctor to move from paper to something digital. Obviously, there are a lot of platforms out there, but as anyone knows, it's that the hardest part is really getting that behavioral change. And the last thing that I'll say is, again, we provide all of our support and all of our training for free. We've seen quite a bit of success with this because now a doctor can just pick up a manual and comfortably begin using the platform. And even if we really focus heavily on outpatient first, because in an inpatient setting, obviously there's a bit more chaos, the conditions are a bit more severe. But the most important thing is that when a patient arrives at the hospital, that the hospital and staff have an accurate picture of that patient's health information, and that when that patient then leaves, that patient has access to their accurate health information. So when they go to their primary physician, they get the care they need and they do not end up back in the hospital. So this isn't quite as technical as and I hope that that's okay, but we're trying to incorporate that to really make sure that we get the boots on the ground, the real drivers, the doctors and the first line health workers to have a very, very simple and easy to use platform that can therefore benefit every other stakeholder in the healthcare ecosystem.